Hi, everyone. Welcome to our biweekly coffee chat. This week, actually, what we'd like to talk about is National Health Center Week. National Health Center Week is an annual celebration recognizing the community health centers and healthcare professionals who provide essential care to millions of people across the country. So this conversation is actually not going to focus on necessarily the technology or coding automation or AI and how it's impacting revenue cycle these days, but rather we're going to talk about the people behind the people, the teams behind the counter, behind the doctors, behind the clinicians, because that is what National Health Center Week celebrates. It celebrates those people who are in the back office making everything tick. So, in talking about those teams, Pam, do you want to walk us through who these teams may be in our lives?
Sure. So, thanks, Anna. Anna highlights something important there in our lives. So I'm going to kind of focus on what's in my life, right? As a technology provider, who we deal with on a daily basis, and these people can really kind of be considered invisible teams because to the patient, they may not have a lot of interaction with them. It might be like submitting forms and things like that, but they don't actually meet the people that are doing this. So let's highlight those people. We're talking about some people in the revenue cycle space in health centers or hospital systems, whatever you want to refer to them as. There's people in patient access, there are coders, there are individuals in clinical documentation, and all of these people kind of initiate the process with the patient, right? So the patient has to have a procedure. They go to their physician. Well, the physician has to now work with authorization to get that patient authorized for that procedure, whatever is required by their payer. It is a pretty complex process. And I don't know if patients probably have an inkling because it can be a little thorn in their side as well when things get kicked back or that's not authorized. So we've all experienced that, right? But these people that work behind the scenes, man, it is tedious. It can be frustrating. There's probably a lot of people that are overwhelmed and understaffed. We know that staffing is a huge issue. And so these people are the ones that are bearing the brunt of it, right? So let's highlight and recognize them.
Yeah, totally. I think it's interesting. I was trying to, in advance of this coffee chat, think about have I ever come in contact with these invisible teams, like you call them, Pam, right? So, for example, both my kids had their tonsils and adenoids out. One of them had them out at a hospital. So, as we know from our interactions with hospitals and ambulatory centers, they work slightly differently, right? The hospital has much more infrastructure, if you will, around it, right? There's insurance verification teams and there's scheduling teams and there's the team that deals with the anesthesia doctor as opposed to the procedure, the actual surgery ENT doctor. And then there are the coders who come in on the back end once the procedure is done and do the coding vis-a-vis the insurance companies, right? And for my son's surgery in the hospital, I don't think I experienced any of these teams. And then a few years later, my daughter had the same surgery at an ambulatory surgery center. It's lovely, it's clean. It's not that the hospital isn't clean, but it's solely focused on pediatric ENT type, tonsil adenoid surgeries. There's all kinds of things on the wall for the kids to play with while they're waiting. There is one anesthesia doctor. There's one, ENT doctor. Everything is very streamlined and straightforward. And I think actually in that case, right, I spoke to the woman who did the scheduling. I spoke to the woman who told me when the billing, when I should expect the bill and how that's going to look and what it's going to be and what was already authorized and what happened after. And, these are the teams that make this experience either completely streamlined and stress-free for a parent who is anxious about their 3-year-old going under general anesthesia, right? Or this can be really stressful. Mm-hmm. Remember we had the conversation with Nicole a few weeks ago in our coffee chat about denial prevention. And her ultimate point was, at the end of the day, it's all about the patients and
Right.
making sure that their experience and their post-procedure recovery is streamlined. So let's celebrate these people. Who else could we highlight in these
Yeah.
teams?
Yeah, the other thing I like to mention about these teams is some of these teams in specific areas of the kind of titles that I mentioned, some of these people are clinicians, right? They are in an administrative or executive role, but they wear a lot of hats, and they might be an MD, they might be an RN, they may be, a CRNA. Like, we have people that move into these positions that are leading teams in health centers and and healthcare that are clinicians. And so who knows better, than someone who has like actually delivered the care of how
Right.
important these processes are to these teams of people. And so I think we run into those on a daily basis. And I'll highlight a few because I have a couple of things that are on the top of my mind. I'm working with a health center right now, and their director of mid-revenue cycle is an MD. And I there's a few things, I'll take a step back or two. There's a few things I think that about me, because we have calls together. But I call MDs Dr. So-and-so just because I am the daughter of an MD. And I don't know, it was ingrained as a young child, and I just always refer to, that's. And so when I see a person that I'm going to meet with that happens to be on a team of, an executive level in a rev cycle team, let's just say, and they have an MD, I immediately greet them as Dr. So-and-so. And I respect that they have an expertise above what they're doing, or to put together, to understand in a different way why this is so important. And
Yeah.
I say that because last week in my call, we go on to a Zoom, right? And the camera turns on, and here's this physician in an elevator, masked just below her nose. And she's like, so sorry. I was just reporting to a code. And I'm like, we can change the meeting time. Like, we're good. I can have this conversation anytime, give you a second to get back to your desk, wash your hands, and take your mask off. Like, but no. She was ready to talk about what we needed to talk about. And that struck me, right? Like, this is a practicing physician who is still responding to things within her health system because those things are important to her. And she's probably on some sort of a committee where that is a requirement of her role.
Right.
She holds this title. She
have to stay current.
right?
Yeah.
You have to. And yet she's also responsible for a team of people that are responsible for the revenue that is coming into that health system on another side, right? On the compliance side, on the coding side, on all. So very interesting. I think I think we're seeing more of that. I think we're seeing more clinicians move into these roles. And so as we have these meetings, I see this. I'm like, oh, she really gets it. She gets it at a different level, or he gets it at a different level because it's affected his career, his whole career.
Right.
And then I say that in one sense. And then I also think of it as these people got into these roles to help patients. Now they're helping patients in a different way, but they're still there because innately they want to help patients. So whether it's making these processes better, streamline, or helping our health centers be more efficient, these are all ways that they're still helping their patients.
Yeah.
I think that I have a couple other ideas I want to talk about when we talk about invisible teams. Maybe I'll just jump into, like, there's more.
Sure.
There's more. Yeah. There's more to even like those teams. If we go like a layer below that, we have like engineers, we have product teams, we have delivery teams, we have support teams. In success, you run a team of people in customer success. So we have clinical auditors. We have those in our company, and hospitals and health centers have those in their companies. And those people are also behind the scenes, but without those people really digging in and really knowing rules, regulations, compliance, all of this is for nothing, because if you're not in compliance, then there's huge fines. There's like everything goes awry. So
Yeah.
when we talk about those people, there's a lot of people in those roles that are also clinicians. So not only are they experts and subject matter experts in their specific, roles and titles, but they are also registered nurses, PAs, medical doctors, and we have one on our team. So our chief medical officer is a practicing ER doctor, and he still does every other weekend, or it seems like every other weekend, where he works 12-hour shifts, and he keeps his hand on, his finger on the pulse, I should say, and he can talk to us as a team. And can give us another understanding about what it means, like what it means to the physicians that are practicing to make sure that these things go smoothly, and what that trickles down to the patient. So we have a better understanding through working with those clinicians. So there's a lot of people that we don't particularly see or recognize, and that's really what we're here for today, right?
Yeah, I think one thing that in that vein, in terms of like these teams, the people on the teams and their backgrounds, that I think is really interesting. When I first joined Milagro, I was talking with Crystal Shaw, who is who's our sort of lead coding and audit and compliance.
Shout out to Crystal Shaw.
I know, right? And we were talking about, the role of a coder, and she's done it for facility coding. She's done it for hospitals and for ambulatory centers. She runs our, audit and compliance on our end to make sure that the coding that we do is compliant, that we're sticking with our accuracy levels and coverage levels that we've committed to. But also, like, she deeply understands the procedures that she is coding. And it's an interesting play between the teams, because on the one hand we have the implementation team, right? They're building the logic and the codes behind each procedure and how it gets coded for the insurance companies. But Crystal can come alongside them and say, actually, this knee surgery, right, ended up also having, I don't know, an implant or an infusion or an anesthesia block. And she can explain in more almost human personal terms, like what that means for the procedure. So it's a nice mix and this sort of parallel track of both, what do the ones and zeros mean, right? Like, how do we build the code? How do we make the technology more efficient for these hospital centers? But also, how do we bring that empathy and compassion? Because at the end of the day, it's a patient who just had their knee replaced or I don't know, right? Like, needed to have an anesthesia block because whatever was happening with their shoulder was so painful. And Pam and I can tell you all about our shoulders if you would like in the comments.
Coffee chat.
But I think it's an interesting point you bring up about, like, the people that you meet at the executive level in the pre-sale process who are still, active physicians in emergency rooms, but also understand the inner workings of the hospital and want to make sure that the revenue cycle and the billing and all of that carries through from one-on-one interactions with the patient during the procedure to the bill they receive at the end of the day, post-procedure, and how is that going to impact, their peace of mind, their recovery, their pocketbook, right? All of these things I think are so important. And it's actually quite nice to have this week.
I think so.
To acknowledge these teams.
I know, because really sometimes it's just a minute to step back and think about it. Like, you and I have this conversation, we know it's coming up, we think about it, we talk about it, but we all, not just us, but we all run in like 1 million different directions, right? So to take a second to sit back and be like, hey, what does actually Health Center Week mean? And oh my gosh, there's so many things we could say about it, right? Because we just don't take a second to sit back and think about it. So actually to take a minute and think about these different teams and roles and who's behind the scenes, it's kind of cool to be able to dissect it and say, wow, we're in this every day. We experience work with these people every day, and let's take a minute to recognize them. I think that we think about that, like, not all. I guess behind every team is a team, right? Because it's a big team, and then there's always someone helping that team. And some of the people that we work with wear scrubs. We work in healthcare, but not all. And some of them are in executive roles, and it's a buttoned up team of people, but some of those people wear scrubs. So it's really interesting when you start digging into these teams and understanding what their responsibilities are. They're big. Their responsibilities are big,
Yeah.
They're meaningful. They mean a lot to the end, patient care. They really do. This whole continuum of care in the United States, probably in other countries too, but let's just focus on ours. So I'm selfish. Yeah. But we have a complex health system here, and it's not getting any easier. It gets more complex. There's lots of changes that are always happening. CMS governs a lot of that. And these people are always having to keep up, always having to pivot, always having to learn new things and be compliant and make sure that everything is working. So, cheers to them.
Yeah. It's not easy. And let's be honest, right? They're not meeting people at their calmest, at their most collected, at their, they're meeting people who are either in, like Dr. Hobbs, who works with us, who's our chief medical officer, works in the ER, I think every other weekend, but I think also during the week, Pam, right? And so the people he's meeting are not there. I was just watching The Pit the other night, and they, they're like in the waiting room, and they approach the woman sitting there who's in, scheduling and logistics, and they're like, the kid's like holding his eye, and he's like, I really need to see someone, and she's like, well, there's a whole line of people,
the other people, right?
And the compassion that has to come with that, but then also like they're meeting these anxious parents, and they're meeting people in crisis, or even like in my situation, right? My kids had scheduled tonsillectomies and adenoidectomies, but I was still a nervous wreck, right?
Yeah. It's nerve-wracking.
It's nerve-wracking. And so really having these people, both the front end, right? Those clinicians and nurses and doctors who meet us, the patient, be calm and collected because they know that the team behind the team is cool, calm, and collected, right? They have the technology they need, or they've got the process and procedures in place. They have the workflows. They know, how to run this well-oiled machine that is the hospital or the ambulatory center and the health center. I think that's what makes the whole experience more manageable. And it's nice to take the week
to recognize
them and recognize them.
Yeah, I think it's very true. There's a lot of different jobs, right? But at the end of the day, it's all for the same purpose. So yeah, let's really celebrate that, celebrate those people, celebrate all the people that make it work for all of us. Yeah.
All of us.
Thanks, healthcare teams.
Thank you.